Hi, Ms.
Hi.
Phillips. My name's Caitlin. I'm a physician assistant student from Jefferson. Is calling you Carly okay?
Yeah.
Okay. Okay, so what brings you in today, Carly?
Well, I've been just feeling overall bad for the past 2 or 3 days, but I've been throwing up the past 2 days.
Okay, so just kind of overview, you're just not feeling well, but for the most part, it's the nausea that's bothering you?
Yeah.
Okay. So that one has only persisted for 2 days?
Mm-hmm.
Okay. All right. So 2 days, and then what were you doing before this began?
Just my normal day. I haven't really been doing anything differently. I thought maybe I ate something bad, but I don't think so because I've been eating with my classmates, so
Okay.
everything that they've been eating, I've been eating hasn't been different, so.
Do you remember anything specifically that you were eating?
Not really.
No. Okay. Is there anything that makes it worse?
If I eat, it makes me nauseous, so I haven't really been eating.
Okay. If you do eat, what happens?
I end up throwing up.
You throw it up. And it's, is it dry heaving? Like, is anything coming up, or?
Well, I've been trying to drink a lot of water, so there's a little bit coming up, but most of it is like if I do try to eat, that's what happens.
Okay. So you can't hold anything down?
No.
Okay. Is there anything that makes it better?
If I lay down, I feel a little bit better. If I just avoid eating altogether.
Yeah. Okay. Okay. And how about the progression of it? Has it gotten any better since a couple days ago?
Honestly, it started off just feeling kind of blah, but then I started throwing up, so it's kind of gotten worse at this point.
Okay. It's gotten worse. And have you ever experienced this type of feeling before?
Yeah, maybe when I was little, a couple of times.
Okay. And what did you do then?
My mom took care of me.
Okay.
A lot of soup and water, I guess.
Soup and water. Okay, did you try soup? Have you tried any soups?
Yeah, but like I said, I threw it up, so.
And you threw that up as well. Okay. All right, so even liquids you're not doing well with?
Not really.
Okay. All right. So is there any pain associated with your nausea?
Just kind of like cramping in my stomach, because
Okay.
I've also been like had a little bit of diarrhea too, so.
Okay. All right. And is that pain or cramping in your stomach, is it radiating anywhere, like your back?
No.
No? Okay. And how about the severity of your pain? 10 being the worst pain you've ever had?
It's not, the pain isn't that bad. It's more the other symptoms that are bothering me. So
Okay.
I would say maybe like a 2 or 3.
Okay. That's fine. Okay. And how about time of day? Is there any time of day that's particularly worse than another?
Not really. I
Nighttime?
mean, I could wake up even after not eating and just think the past 2 days have just been horrible.
Okay.
Anytime, really.
So you are waking up during the nighttime?
Yeah.
Okay.
To throw up.
How often do you say you're getting up in the middle of the night?
It depends. Maybe 2 times.
Okay. Yeah, that's not good. Okay, so I'm just going to ask you a couple questions.
Okay.
Just answer yes or no to some of them, okay? So how about, what is your usual weight?
Around 155.
Okay. Have you noticed any recent weight changes?
Just within this week, because I haven't been eating as much, I kind of feel like maybe it's around 150, 152.
Okay. Alrighty. Are you feeling like your clothes are fitting a little looser, a little tighter?
Not like super noticeable.
Okay. And weakness? Are you feeling weak? So
Yeah.
like loss of muscle energy?
Absolutely. I don't really have energy to get up and do anything. Don't really want to study. Just because I'm so tired. And
Sure. I can imagine. How about fatigue? Just tired?
yeah, definitely.
Fatigued. Okay. And how about any fevers? Have you had any fevers?
Yeah, I've had a fever of like 101, 102 the past 2 days while I've been having these symptoms.
Okay. And how did you take your temperature? Was it orally?
Yeah.
Okay. Okay. Let's see. So a couple more questions for you.
Okay.
Have you had any trouble with the swallowing?
Not really.
Okay.
No.
Okay. Heartburn,
No.
and your appetite's been weak, and you have the nausea. Bowel movements you're having, the diarrhea.
Yeah, they're all loose. It's all
Loose stools. Okay. So like, would you say it's watery?
Yeah.
Okay, very watery.
It can be.
Okay. Is there pain when you're having a bowel movement?
It burns a little bit, but it's not.
Just from going so often,
Yeah,
maybe?
I think.
Okay. And you have some abdominal pain. And you have no other, like, food intolerances that you know of?
No.
Okay. And you didn't go out to eat before this started?
No.
You were just kind of eating at school in the
Yeah.
cafeteria with your friends? Okay. Do you have any hemorrhoids?
Nope.
Constipation?
No.
Okay. You have having just the abdominal cramping, no actual pain, correct? Okay. How about excessive belching or passing of gas?
No.
Okay.
Not right now.
Okay.
I'm
Alrighty.
kind of too nervous for that, so I usually just end up going to the bathroom.
Okay, that's fair. Okay. Yeah. Okay. Have you tried to take anything for your symptoms?
I took a Tylenol the other day to try to help with like fever and stuff,
Okay.
but I mean it might have helped, but I took a nap, so I don't really know.
Okay. All right. So you think the napping is kind of helping too? Like, how do you feel when you wake up from your nap?
I still feel tired. I just still feel I'm so weak. I just feel so worn out.
Okay.
So.
All right. Okay. Going back to the diarrhea, when did that start?
Around the same time, so 2 days ago.
Okay. Okay. And were you doing anything, or is it kind of just the same as the other?
Same exact thing. Kind of just came out of nowhere.
Okay. And how about when does that worsen?
It honestly, I have no idea. It's just kind of sudden, so.
Okay. Would you say it's kind of happening at the same time as throwing up?
Yeah, I would say definitely around the same time, but I would say I've been having this more often. I just hate throwing up, so that's what I'm more worried about.
Okay. Okay. That's understandable. And nothing makes it better or worse?
No.
Okay. Have you ever had this excessive diarrhea before?
Yeah, again, the same thing. When I was little, I had the same thing with the throwing up.
Okay, so you're
very similar.
associating.
Yeah.
Okay. Alrighty. Okay, so I'm going to just ask you some other questions. How about any other medications that you're taking?
I'm on birth control.
Just on the birth control. How about any vitamins or holistic medicine?
I take vitamin D, vitamin C, and B12.
And B12.
In like a gummy form every day.
Okay. Okay. Do you know what birth control you're on?
Weeber, but I don't know the strength.
Okay, no problem. Okay. And that's everything?
Yeah.
Okay. And how about any allergies, known allergies to anything?
Just seasonal.
Just
But
seasonal.
that's all I know of.
Okay. Okay. Alrighty. I'm going to just ask you some past medical history that may pertain to this. So you said in your childhood we've had these feelings before of the nausea, the diarrhea.
Yeah.
Okay. Is there any other childhood illnesses that you can remember that could possibly be affecting you as an adult?
When I was in high school, I had mono, and it was pretty severe. So I had it for a number of months. I was really tired, worn out. But this tired seems like out of nowhere, as the other not tired with the mono was kind of like persistent. It was just kind of all the time.
Okay.
So, and I definitely didn't throw up when I had mono.
Okay. Okay. And how would you say you were when you had that?
I guess I was like 16.
Okay. All right. Any other childhood illnesses that you can remember?
No.
Okay. Alrighty. How about as an adult? Do you have any other illnesses, high blood pressure, anything?
No.
Nope.
Mm-mm.
Okay. How about any past accidents or injuries?
Nothing major.
Nothing major.
No.
How about minor things? Did you have any broken bones? Any surgeries like?
I've broken fingers, but nothing that I've ever gone to the hospital for.
Okay. You're a tough girl, huh? Okay, and then hospitalizations. Have you had any surgeries?
Yeah, I was not hospitalized, but I had my wisdom teeth removed. My senior year, so I was 18 then.
Okay. Alrighty. How about immunizations? Have you gotten any shots recently?
I'm very up to date because my school makes me. But
Okay.
I actually just also had the Gardasil shot. I just completed that
okay.
whole thing. I didn't get it when I was younger.
Okay, that's good to know. Have any screening? What do you do on a yearly basis to keep up with your health?
The only thing that I've done is I go to GYN for like a yearly PEP. But besides that, and like I guess she does like breast screenings, but not like
awesome.
a mammogram.
Good. That's great. Okay, so moving on, I just have some questions about your family history.
Okay.
I think what's important to note, do you have any family that have any GI problems, illnesses, diseases?
I know my dad has some like intolerances and like with indigestion, but I'm not sure if he knows like specific triggers.
Okay.
But besides that, I'm unaware of any with GI.
Okay, so he's not allergic to any foods?
No.
Okay.
I just know he has kind of like an issue with digestion.
Okay. How old is your dad, do you know?
He's 57.
57. Okay. And overall his health is?
Overall, pretty well.
Okay. All right. How about anyone else in your family?
Not with indigestion issues.
Okay. So then let's just step back and say, in your family, is there any other illnesses that could be important?
Anything.
Okay. Yeah.
Both my grandfathers had diabetes.
Okay.
My grandfather that passed away was my dad's father. He had Alzheimer's disease. And he had a pacemaker defibrillator, so I know he had also like a coronary artery thing going on.
Okay.
My grandma's, my dad's mom has fibromyalgia.
Okay.
And she has like some stress issues, so like anxiety disorders.
Okay.
My mom's mom had, she's fine, but my mom has endometriosis.
Okay.
My brother's autistic.
Okay.
He has Asperger's syndrome. Besides that, pretty much fine, I guess. Both my grandmas have had like knee and hip replacements though, so they have like, their joints wear out pretty easily.
Okay. How old was your grandfather when he passed away? Your dad's dad?
He was 86.
86. Okay. And how old was your mom?
When?
Just now.
Oh, my mom is 50.
Okay. And your brother?
He's 26.
Okay. All right. Thank you. Okay, so I'm just going to ask you a little bit just about your social life, just to get an idea. Tell me about some of your interests.
Well, I'm in school right now. I'm actually in PA school as well.
Okay. That's awesome. Congrats.
Thank you. But besides that, I don't really have much of a life. I have a boyfriend. I hang out with him a lot. We like to take our dogs on hikes.
Okay.
I like to go shopping. I like spending time with my friends.
Okay. So you're not married. You just have a boyfriend. Okay. And where are you from?
I'm from Reading, Pennsylvania.
Okay. I went to undergrad there.
Oh, okay.
How about, who do you live with? Who lives in your household with you?
Right now I live with a roommate here, but at home I live with my mom, dad, and brother.
Okay. And who's your support system while you're so stressed out at school and things like that? Who's there for you?
My parents are great. My grandma, my friends, and my boyfriend.
That's great. Glad you have that. It's
Thank
definitely helpful. Before being sick, how was your sleeping habits?
Pretty good. I sleep often. I think ever since I've had mono, I've been sleeping a lot more than usual. I kind of need it in order to get through the day, have enough energy. But I would say pretty typical for 20-something year old.
Okay. How about just diet and like fluid intake? What is your normal diet and stuff like?
I really only drink water. I'm not a fan of like soda and stuff like that. And food intake, I always eat lunch and dinner, but sometimes I don't eat breakfast. I'm not a real fan of breakfast foods.
Alrighty. And kind of an important one, how about coffee? Do you drink coffee?
I do drink coffee.
Okay. And have you been able to drink coffee the past few days?
Not the past couple days.
Okay. Alrighty. Is that, you think, will trigger some diarrhea and things?
Maybe I don't really want it like I usually do during the week to keep me awake. I've just kind of been so tired, I just don't even want it. So.
Okay. How many cups of coffee do you have a day?
Just one.
Okay. Okay. Do you smoke?
I don't.
How about drink?
Yeah, socially.
Drink socially. Okay. And when you go out to drink, how many drinks would you say you have?
I guess it just depends on the occasion. It could be none if I go out, or I could have maybe 2 or 3.
Okay. That's good. And you don't drive when you drink, or do you drive when you drink?
I call an Uber.
Okay. Okay, good. How about any drugs?
No.
Any prescription drugs?
Mm-mm.
Okay. How about in your family history? Has anyone had any drug dependencies, alcohol dependencies?
Nope.
Okay. Good. How would you perceive your level of stress at this point?
Right now I'm kind of stressed out just because I'm sick and I'm missing things and I'm not able to study as much as normal. But I think I've been adjusting pretty well to, the new life of being in grad school.
Sure.
But
good. I'm glad to hear that. How about, have you taken any laxatives recently?
No.
Okay. Okay. All right. And how about, I'm just going to ask you kind of a personal question. If you feel comfortable answering it, please do. And if not, just let me know. With your boyfriend, are you practicing safe sex?
Yes.
So you're using protection?
Well, yeah, most of the time.
Okay, what kind of protection are you using?
Well, I use the contraceptive pill, and sometimes I use condoms.
Sometimes. Okay, so what makes you not wear condoms?
Well, I guess I'm more worried about being pregnant than I am getting an STD, from him. We've been together for almost 3 years, so we just don't always really use them.
Right. And what kinds of sex are you guys partaking in? Oral, butt sex?
Just regular vagina sex, I guess.
Okay. Okay. And just how about at home? Are you feeling, not just at home, anywhere with anyone, do you feel safe? Is there anyone that makes you uncomfortable or has hurt you in any way?
I feel safe.
Okay, good. I'm glad to hear that. Okay, so I just have some more yes/no questions to ask you. I want to ask you actually about your genital questions, since your mom has the endometriosis and everything like that. I want to make sure this has nothing to do with that.
Okay.
Okay, so when did your period begin?
I was 15.
Okay, 15 years old. And that's normal?
Yeah, pretty much. I when I first got it, it was pretty heavy, so that's actually why I went on the pill. But it wasn't as severe as like what my mom was experiencing originally.
Okay. How old was your mom when she got the endometriosis? Do you know?
I'm not sure. I know she was diagnosed with it while I've been around, so I think I was in middle school when she was diagnosed with it. I think it's something she just dealt with for a long time.
Okay. How long do your periods last?
They're really normal now, so anywhere from like 5 days.
5 days? Okay. And when was your last menstrual period?
About 2 weeks ago.
Okay. And you said that your amount of bleeding is much more normal today than it used to be?
Absolutely.
Okay, that's good. Do you have any bleeding between periods?
Not anymore.
Okay. How about after intercourse?
No.
Okay. Do you experience any vaginal discharges?
Just like normal. It's
Female
nothing.
discharge.
Yeah, nothing that alarms me.
Okay. How about any itching?
No.
Sores?
No.
Lumps?
Nope.
Any history of sexually transmitted diseases?
Nope.
Okay. How about your boyfriend?
Nope.
Okay, that's good. Any possibility that you're pregnant?
No.
So did you take a test?
No, but I mean, I guess there's always a possibility, but I'm very faithful with my pill. So I actually haven't had sex this month, so.
Okay. Alrighty. We may still check for it anyway, but we'll just note that. Let me see here. And you've never been pregnant before?
No.
No abortions or anything like that?
Nope.
Have you ever tried any other birth control methods? Like, did you ever have the NuvaRing or anything like that? Have you always been on the pill?
I've tried different pills, but never any different types of birth control.
Okay. Good. Alright, so I'm just going to continue with these questions. Okay, I'm just going to review all the systems of your body to make sure everything's in working order, if we have to focus on anything else that's going on. So just with your skin, have you noticed any rashes?
No.
Okay, how about lumps?
Nope.
Sores?
No.
Itching?
Nope.
Dryness?
I always have dry skin.
Always have dry skin? Okay. How about changes in the color of your skin? Any jaundice, yellowing?
No, I've kind of been pale. I just think I'm like excessively hot from having like the fever. So I've just kind of been, I think, experiencing that.
Sure. How about changes in your hair and nails?
No.
The thickness of your hair. Okay. How about that? Is that dry like your skin is?
No.
You just feel okay. How about any moles of yours? Have you had any changes in color or sizes of any of your moles?
No.
Okay. Okay. How about have you have any headaches?
I've had like a little bit of a headache, just kind of associated feeling the past 2 days. I've been kind of feeling rough, but besides that, no.
Okay. Have you taken anything?
Well, the Tylenol
Just
for
the
the fever and stuff, but.
Okay. And have you had any history of a head injury?
No.
Okay. Any dizziness and lightheadedness?
I've been a little dizzy just because, again, I'm associated with feeling the way I have been.
Okay. How about your vision? How has your vision been doing?
Fine. Nothing changing. I mean, I wear glasses, but besides that, nothing's been different.
Do you have contacts?
I don't.
Okay, so you just use your glasses every day? Okay. When was your last exam?
In December.
Alrighty, good. How about any pain?
No.
Redness in your eyes?
No.
Excessive tearing?
No.
Blurred vision or doubled vision?
Nope.
Okay. Spots or specks?
Nope.
Flashing lights?
Uh-uh.
Any history of glaucoma or cataracts?
Nope.
How about in your family?
My grandma had cataract surgery, actually.
Okay.
Now that you mentioned that.
Yeah, that's good. Okay, how's your hearing?
Fairly good, I guess.
Okay.
I mean, I've been tested at my other primary care doctor before. Everything seemed fine.
Good. Okay. How about any ear infections? Is that something you experience?
Yeah, I used to get chronic ear infections as a kid, so.
Okay.
I never had the tubes though.
Okay. How about any vertigo?
No.
Dizziness? Like dizzy spells, I would say. Okay. Any earaches recently?
Nope.
Infections?
Mm-mm.
Discharge from your ears?
No.
So no decreased hearing. You said you're doing well.
Mm-hmm.
Okay. How about frequent colds?
No.
Okay.
I mean, everyone's sick in PA school occasionally, but
hasn't hit you yet.
Yeah,
Maybe.
Maybe this is.
Yeah, I'm sure. How about any nosebleeds?
No, I've never had one.
Okay. How about just sinus trouble in general?
Only when I get like a minor cold, I get like stuffy. But besides that, no.
Okay, but not on a daily basis or anything like that. Okay. All right. When's the last time you went to the dentist?
My mom's my dentist, so.
Okay.
Recently.
Okay. Well, it was really nice meeting you,
It was
Carly.
nice meeting you too.
And I hope to see you soon.
Thank you.